Hi guys, Emily back here again, this time to talk about edema management and inpatient rehab, which is a course that I teach for ARC. This is one of our most popular courses and it's one of the topics that we get the most questions about. But why is that? Why is edema management something that so many people feel intimidated by or not really equipped to treat? Well, edema or chronic swelling is a problem that you as a clinician are going to see again and again and again and again with your patients. If you've got 10 patients in your caseload, chances are 8 of them are struggling with chronic swelling if you've got a geriatric caseload. So this is an issue that comes up for many reasons. Someone might have edema because of diabetes, because of a prior CVA, because of surgery or trauma. They might have edema because their lymphatic system just isn't working as efficiently as it used to be. There's a lot of reasons that people can have edema, but the fallacy of thinking out there is that it'll go away by itself. And that's why, as clinicians, we get basically no training on this. If you want to be able to work in edema and to be able to address this for your patient, you have to seek additional training. It just doesn't come by itself. So when I got my certified lymphedema therapist designation, the first thing I wanted to do was teach other therapists, you don't need to be certified to do this. These techniques are really straightforward and you can get the skills, you're going to be able to do it. So why do these in the first place? There's going to be a lot of reasons that edema is really going to put a dampener on your patient's outcomes. Firstly, there's the mobility aspect. If your patient can't move around, or if their skin is constantly getting infections, they're getting cellulitis because of chronic swelling and decreased circulation, it's going to be a big issue, and it's going to mean that your patient will be housebound, that they won't be able to leave their home, or that they'll be going into hospital again and again. This has obvious implications for your practice and for your person's quality of life. If your person has chronic swelling in their feet, they're probably not going to be able to put on shoes. And that's a big deal. If they can't put on shoes, they can't go out of the house, or they'll go out of the house in like flip-flops or slipper socks, which means that their feet are going to get injured. And again, if they've got chronic swelling in the foot, that injury is not going to heal very quickly and it's likely to get infected. Then there's a reason of including edema management in your practice because of our productivity measures as clinicians. If you're able to bring your patient's swelling down in their, say, knee replacement a lot quicker, you're going to get that range of motion back, that person won't need to be in hospital as long, their satisfaction ratings are going to go through the roof, and rinse and repeat for any other patient that you come into contact with. And believe me, your administrators are going to appreciate that because they're the ones who are looking at how long are people in the hospital and how much money is that costing them. So, that's a little tip to get them to pay for your education. So as you can see, edema is a chronically underdiagnosed, misunderstood and undertreated condition. People aren't diagnosing it correctly as edema so they can get the treatment. When it is diagnosed, people don't understand the treatment to give, clinicians don't understand, and it's a misunderstood condition. There's a lot of myths out there about edema. Number one of being that it'll go away by itself, but there's a lot that follow. Salt diet, ice will help, retrograde massage will help. All of these are incorrect, and I'll talk a little bit more about that in our next video, so tune on in.